All right, let's get right into it. In the world of medicine, some drugs are different. They're incredibly powerful, sure, but they also walk this razor-thin edge between healing a patient and causing absolute catastrophe. So, that's what we're going to break down today. What exactly are these high-alert medications, and why understanding them is quite literally a matter of life and death?
So first things first, we've got to get to the heart of the issue. What is it that actually makes a medication high alert? Well, it all comes down to that tiny, tiny margin for error.
And wow, this quote really just says it all, doesn't it? Think about walking a tightrope. On one side, you have the incredible, life-saving benefit of a drug, but on the other side, a devastating outcome. High-alert medications live their entire existence on that tightrope.
Okay, so what's the official definition here? Well, the Institute for Safe Medication Practices, you'll hear them called ISMP, they define these as drugs that carry a heightened risk of causing significant patient harm if an error happens. And that word significant is key. We're not talking about a minor side effect here.
And this is a really important distinction to make. High-alert meds are not necessarily the drugs that get mixed up the most often. Nope, they're the ones where even a single tiny mistake can lead to devastating, sometimes irreversible harm. That's the whole ballgame right there.
So you might be wondering, how do we even keep track of these drugs? Is the list just set in stone? Not at all. It's constantly changing based on new data. So let's jump into the most recent update because it tells us a lot about how this all works.
You see, the ISMP doesn't just make a list and walk away. No way. They are always monitoring safety reports from all over the world. And just this year, in January 2024, they put out a brand new update. And with it came a very important new addition to the list.
And here it is. The newest drug to be officially named a high-alert medication is tranexamic acid, specifically the kind you inject. Now, this is a drug that's used all the time to control or prevent really bad bleeding. So, it's a lifesaver, right? What could possibly be the problem?
Well, here's why. It all came down to a scary pattern of errors. There were reports from all over the world of this drug being given the wrong way. We're talking injected into the spine instead of into a vein, all because the little glass containers, the ampules, looked almost identical to other drugs. These weren't just one-off mistakes. This was a systemic problem waiting to happen.
And that, right there, is the lesson in a nutshell. Tranexamic acid is an amazing drug when you use it right. But when the systems around it, like the packaging, the labeling, the way it's stored, when those systems fail, it can turn deadly. The problem wasn't the drug's fault, it was the failure to build enough safeguards around it.
Okay, so this brings us to a much bigger point. We've been talking about one specific drug, but this whole concept of high alert is broader than that. It's not just about memorizing a few drug names, it's about recognizing entire categories of medications. Just take a look at this list. We're talking about whole classes of drugs here. Things like anticoagulants, blood thinners, every single formulation of insulin, powerful IV opioids, drugs that temporarily paralyze muscles, even things like concentrated potassium. By grouping them like this, hospitals can create big, system-wide safety nets instead of just hoping everyone remembers hundreds of individual drug names. It's a much smarter way to tackle the problem.
So if we know these drugs are so risky, the answer is just for doctors and nurses to be extra careful, right? Just try harder. Well, it turns out that modern patient safety science says that is exactly the wrong way to think about it.
Which, of course, leads to the big question. If just telling people to be careful doesn't work, and it doesn't, then what is the answer? How do you actually protect patients from these risks?
This slide really captures the massive shift in thinking. The old way, the outdated way, was to blame the person. You made a mistake, you just weren't being careful enough. But the modern, evidence-based approach, it accepts that humans are, well, human. We all make mistakes. So the goal isn't to create perfect people, it's to design safer systems that make it really hard to do the wrong thing and really easy to do the right thing.
And this quote just hammers the point home. This isn't about scolding people, it's about being smart. It's about designing systems with guardrails and safety nets that assume an error might happen, and then catching it before it ever gets to the patient.
All right, so what does this safety net actually look like in a real hospital? Let's break down the practical, real-world strategies that facilities use to build one.
You can think of it like 6 main pillars. First, independent double checks. That's having a second clinician verify everything from scratch, using standardized drug concentrations across the board, which means less complex math and less room for error. using smart pumps that have safety limits already programmed in. Simple things like clear labeling and physically separating drugs that look alike. Restricting who can access these meds, and of course, constant training to make sure everyone is up to speed on the protocols.
And let's be crystal clear about this. These are not just annoying extra steps or bureaucratic hoops to jump through. Absolutely not. They are structured, essential safeguards. They're a core part of being a healthcare professional, just as important as knowing the science behind the medicine itself.
And that really brings us to the single biggest takeaway from all of this. When it comes to high-alert medications, safety isn't an individual burden that rests on one person's shoulders. It is a system-wide responsibility where everyone in the organization plays a part.
And we'll leave you with this final thought. In today's healthcare world, building and following these kinds of safety systems, well, it's not just a nice idea. It's a fundamental professional obligation. It's how we respect that narrow margin for error and make sure we're always landing on the side of healing.